Now let's talk about our bear. He is using his parasympathetic nervous system, and that is going to help with rest and digest. So in a lot of ways, the parasympathetic nervous system is going to be the opposite of the sympathetic nervous system, so we should see pretty much exactly the opposite effects. So the parasympathetic nervous system is going to increase digestive secretions, so saliva, stomach acid, things that help you digest your food. Is going to increase peristalsis, the waves in your stomach and your intestines that help you digest, and bladder contractions, that help you urinate to eliminate food and drink from your body. And you are going to have a slow heart rate and a slow breathing rate. Remember that the sympathetic nervous system was what you had under stress, so this is what you should be using the entire rest of your days. So when you're not under a stressed condition, your parasympathetic nervous system should take over and be causing these symptoms. So in the pharmacology world, we have drugs that mimic this parasympathetic nervous system, and they are called cholinergic drugs. So cholinergic drugs are going to have the same effects as the parasympathetic nervous system. They are going to increase secretions, they are going to increase peristalsis and bladder contractions, and they are going to increase muscle strength and decrease respiration. And just like adrenergic drugs have anticholinergic drugs, cholinergic drugs have anticholinergic drugs. And we are going to be using these in the OR. So they are going to have the opposite effects. They are going to decrease secretions. They're going to decrease digestion. They're going to not suppress your respiration. And cholinergic drugs are going to slow your heart rate. So these are going to not slow your heart rate. Just going to have the effect of increasing your heart rate, increasing your respiration. So when we talk about cholinergic drugs, the pharmacology book talks about the 3 Ds. So drying, which is decreasing the secretions, decreased motility in the GI and GU systems, genitourinary and gastrointestinal, and it is going to dilate your pupils. So in the OR, we are going to use atropine, and scopolamine. And scopolamine is going to be given as an anti-nausea and vomiting drug post surgery, because they are going to decrease the digestive processes and secretions in your body. So that is going to make you feel less nauseous. But scopolamine is also going to be used to decrease secretions before surgery so that our patients don't aspirate during intubation. So if you've got stomach acid and saliva in your esophagus, when they intubate and they relax all those muscles, we don't want that coming back up and getting into their airways. So we use scopolamine to dry those secretions up before we get started. And the side effects of cholinergic drugs and anticholinergic drugs, just like the adrenergic drugs, are going to sort of mimic the parasympathetic nervous system, that they're either increasing or decreasing. So cholinergic drugs are going to have side effects of nausea, secretions and digestion increase, and vomiting and diarrhea. Same thing, if you're increasing peristalsis, you might increase it too much to cause diarrhea. Sweating, which is going to fall under secretions. Bradycardia, because like I said, it slows your heart rate. Bronchospasm, you're going to be increasing peristalsis and muscle strength, so it can cause spasms in the bronchioles, which are the trunks that go down to your lungs from your trachea. So you can cause a spasm in those. It's going to close off, make it hard to breathe, because of the overactivation of the parasympathetic nervous system. And it can cause respiratory depression because we are decreasing respiration because we're trying to calm ourselves. This is the calm state of our nervous system. So anticholinergic drugs are going to be doing the opposite, because they are going to be decreasing the parasympathetic nervous response. So the side effects are going to be dry mouth, because we're drying our secretions. Urinary retention, because we have decreased the genitourinary motility. Constipation, because we've decreased the motility in the gastrointestinal system. Blurred vision, because we've dilated our pupils. Confusion, I really don't know where that one comes in. Confusion. And tachycardia, because we are going to be increasing the heart rate. And just a quick note that in the back of the autonomic nervous system drugs chapter in the pharmacology text is a really good diagram of the sympathetic versus parasympathetic system, the adrenergics and antiadrenergics versus the cholinergics and the anticholinergics. And you can kind of see that the adrenergics, which increase the fight or flight, are going to have similar effects to the anticholinergics, which are going to decrease the rest and digest, and that the cholinergics, which are going to increase the rest and digest, are going to have similar effects to the beta-adrenergics, which are going to decrease the fight or flight symptoms or responses. So these two are going to be similar, and those two are going to be similar, and these are going to be the opposite of those, as these are going to be the opposite of those. So hopefully that helps you to sort those out in your head and be able to predict some of the side effects and why we would use them in the OR. Hopefully this story about Andy and the bear will help you to remember a couple of key terms. So Andy was using his sympathetic nervous system, which is fight or flight, because he was going to run away from the bear. And the sympathetic nervous system drugs are the adrenergics, like Andy, who's being chased by the bear. Now the bear is using his parasympathetic nervous system for rest and digest, and you might be able to remember that parasympathetic rhymes with parasympathetic. And these are the cholinergic drugs and anticholinergic drugs.